Okay, Bell's palsy and cranial nerve. So Bell's palsy is a neurological disorder that causes weakness or paralysis on one side of the face. And as you can see, it causes drooping eyebrow, eyelid, and in the corner of the mouth, and it's like all connected to the facial nerve. And this is just an image of a person with Bell's palsy, and as you can see, she has a drooping corner of her face, and her eyelid, and kind of her nose. And some facts about it is it's the most common cause of unilateral facial paralysis, and it can affect anyone at any age, and it affects the 7th cranial nerve. So the length, it usually resolves on its own within 6 months, but in some cases it may last longer, or it can even be permanent. And now moving on to the cranial nerve. So it is a set of 12 nerves that send electrical signals between the brain and the head, face, neck, and torso. And those are the 12 different nerves. For the functions, for sensory, it helps you see, smell, taste, hear, and feel sensations. For motor, it helps you make facial expressions, blink your eyes, and move your tongue. And it also helps regulate glands. And that is all.
The central cranial nerve is the nerve responsible for all of the movement and senses in the face. It starts at a region behind the ear and stretches to 5 major branches. These branches include the frontal branch, which is responsible for movement of the forehead and eyebrows.
The temporal branch, responsible for the movement of the eyes and eyebrows.
The buccal branch, which is responsible for the movement of the cheeks. The marginal mandibular branch, which is responsible for movement of the lower lip. The cervical branch, which is responsible for movement of the neck and the chin. First the occipital bone, then the parietal bone, temporal bone, zygomatic bone, mandible, maxilla, frontal lobe, and nasal bones. First we have the temporalis, responsible for movement of the jaw. Then we have the orbicularis oculi, responsible for movement of the eyes and eyelids. And finally the orbicularis oris, responsible for movement of the mouth.
And now here are some Bell's palsy exercises, and you're going to want to do 10 of each of them. So first, you just want to smile, and then just lift up the corner that is drooping. And now you're going to make an angry face and push your eyebrow in, and then raise your eyebrows and pull it up.